Burundi is facing a mounting humanitarian pressure as tens of thousands of people flee renewed violence in Eastern Democratic Republic of Congo. Since late last year, more than 100,000 refugees, many of them women and children, have crossed the border into the small East African country, placing strain on already limited health services and infrastructure there. Aid agencies warn that the overcrowded shelters, limited sanitation, and the risk of disease outbreaks are creating a fragile public health situation. The World Health Organization is working with the Burundian government and humanitarian partners to strengthen emergency health services and prevent outbreaks among displaced communities. Well, to discuss this a little bit further, we're now joined by Dr Marie-Roseline Belizaire, who's joining us on the line now. Thank you very much indeed for joining us and welcome to the program.
Good morning. Thank you for inviting me. It's 6 a.m. for me. I am in DRC, Democratic Republic of Congo, and I'm so happy to share that information with the public.
Thank you for waking up for us to talk about this very, very important story. Perhaps you can start by giving us a sense of what the situation is like on the ground. I mean, we're seeing and hearing that Burundi is receiving tens of thousands of people fleeing conflict in the DR Congo. What is the situation on the ground at the moment from what you're seeing?
Thank you for that question. Very important. So to give you a sense, I was in Burundi last week, so where I visited the camp together with the regional director of WHO Office for Africa. So we could see from first hand what is happening in that. As you mentioned, since late 2025, more than 100,000 refugees, and most of them are women. I think more than 50% are women and also children. They have crossed into the country. So as you also mentioned, it has been an increase of demand of health services, not only for the refugees, but also for the hosting community. You know that having more population also put a very bigger strain in the community already living that. So in our side, WHO and other UN agencies like UNICEF, UNHCR, and also other NGO like MSF, we are really supporting the government in order to come with a solution, not solution, but with helping this community in need. So far we have a lot of risk, and the challenge are very dire in that. So one of the challenge we have in the refugee camp is access to clean and safe water. That also increase the risk of illness spreading quickly, you know, in a crowded area. So we also have the risk of infectious disease like cholera and mpox, and have been also identified in that facilities. So, and other risks also that we have is women, maternal health, women that are delivering sometimes in a bad condition. So, so far, what have we done in order to support those need? So we, in WHO side, we implement a health clinic, and so with all the 4 basic components, with a pediatric consultation, maternal health, and small surgery, and vaccination also are part of it. So in a day, we can receive more than 400 patients every day, and most of them are women and children. So from January, when the clinic has been installed, until the day I visited, it was on 6th of March. So we have already conducted more than 78 deliveries for women, for pregnancy women. So other needs also is the education. You know, we have a very high number of children who are not going to school now. So it is also I think a risk when you're having those children. So far, what we also did, we put a vaccination considering all those children are 0 dose, and we vaccinated them with all the antigen that are available for that camp. So let me stop there if you have other questions.
So, I mean, you've described quite a lot there, and I think the physical risks are quite prevalent, and you've described them well. I would imagine that there are mental health issues as well, particularly for children in this kind of environment. Is that something that's being addressed?
Absolutely, absolutely. So now WHO in the emergency program, we also have a component of mental health in emergency, and it is really well established in that facility now. We are working with a local NGO where we train a psychologist ed. They are not totally psychologists, but they receive the training in psychological support in order to give that support. So far, we have 19 that have been placed in the camp. So they have their clinic, and they are really having a high number of depression, a high number of post-traumatic stress disorder, and we are really taking that also into consideration. So other aspect also that we take into consideration is disability in emergency. We know sometimes we overlook those with special needs, and that time we make sure that those who need wheelchairs, they receive them. That who need those, what's the name, to work with, so they receive what they need. And we have some children with disabilities, and we provide also the special needs that their parents need in order to take care of them.
You talked about the fact that these overcrowded camps and limited sanitation can lead to outbreaks of diseases such as cholera and even measles. Has there been any outbreaks at all that are heightening this fear?
So even before the refugee camp has been putting in place, so Burundi was facing some emergencies like cholera, mpox. If you remember, Burundi was a very affected country with mpox after DRC in last 2024 and before. So they still have the risks. Even though the number have really decreased, but those situations still exist, and the camp is not exempt to them, because those diseases are also consequences of lack to clean water, of sanitation, and in crowded environment, it is a very, I can say, a very I mean, this environment can facilitate the spread of all those diseases. Yes, we have registering some cases, but we have been able to control quickly because it's a really, I can say, the perimeter was really done quickly, and we have been able to control those outbreaks. So now we are really working closely with other partners in order to increase access to sanitation. Even the First Lady, she's also working to support that access to water, and we are working really back to back with her and all other partners for that a challenge, I mean, to be solved soon.
All right, that's where we're going to have to leave it. Thank you so much indeed for that update. And we wish you well and strength with the important work that you're doing, particularly with these displaced people in Burundi. Thanks for your time.
Thank you so much. Good day.
That was Dr. Marie-Roseline Belizaire, who's Emergencies Director at the WHO Regional Office for Africa, sharing some insights on the urgent humanitarian and health response in Burundi. We're seeing people fleeing the eastern DRC. More than 100,000 have fled into Burundi, putting serious strain on Burundi's health system.